Hi, mic testing one, two, three. So, how is the quality of audio? And also let me know about the video because I'm using mobile data. So, do confirm these two, the audio and video. We'll proceed with our today's discussion, mainly focused on antihypertensive drugs. So, I think, yeah, this is the camera. So, I'll look here. Yeah, hi, a very good morning. Okay, perfect. So, uh, we don't have park and I'm not outside. I'm in my parking area, so I'm not wearing a seat belt. So no controversy. I just started the engine. Okay, yeah, everything is perfect. That's good to hear. So a very good morning, all of you. So today's live session will focus on the following topics, as I mentioned prior, as you can see in the thumbnail. But before that, I have homework questions because for the past few days, I have been giving you homework questions at the end. But this session will start with our homework questions. So what is this? So I want you guys to check your respective toothpaste. I mean, after this live session, just observe your toothpaste, observe the composition of your toothpaste, and then get back through mail with this homework. Because I want you to find out the composition of the toothpaste. See, it might slightly vary from, yeah, it could be close up or Colgate, doesn't matter. I'm not trying to promote any brand here, but I want you to find out the contents of this toothpaste. How much amount of is fluoride present? How much amount of fluoride is present, if at all it's incorporated? Is triclosan present? And what are various antimicrobial agents that are incorporated in this, foaming agents, etc. Okay, so just observe the composition and also the amount of fluoride that's present in your toothpaste, and then consider this as your homework. It will be very much interesting. We might have never seen the composition because we brush teeth in a state of semi-consciousness. So obviously it's really a challenge to go through the composition of the contents of toothpaste, but do go through it. And also let me know if your toothpaste contains not salt, but triclosan. Okay. So triclosan, fluoride, its composition, try to focus on these areas and consider this as your homework. It will be fun. And the second homework which I wanted to give you is, have you I mean, in your family you might have seen your family members or your acquaintances using antihypertensive drugs. So that's your second homework. So observe their medicines. You're a doctor, you're permitted to, right? Even if you're not a doctor, you're permitted to. So observe, note down, just casually inquire them like how many tablets they're taking and how many times they're consuming each and every day and how many variety they're trying to take. So this exposure. Okay, so this kind of practical exposure will allow you to easily remember the drugs, especially the major classes of antihypertensives which you will come across. Okay, yeah, exactly. I mean, if you are familiar with the names of the drugs, you can post them in the comment section. Now, I'll let you know, guys, my homework as well. In fact, when I observed some of the medications that are being taken in my home, I've seen my family members taking beta blockers. So beta blocker is something which is commonly prescribed, a major class of antihypertensive drug. So beta blocker, so all alols, atenolol, propanolol, etc. So metoprolol is something which is commonly prescribed. So metoprolol, 50 milligrams once daily. That's what I've observed. My family members, one of my family members taking the same. And what about ACE inhibitors or ACE blockers? You might have heard of losartan, candesartan. So losartan, candesartan, 50 milligrams again once daily. So that's another major class of antihypertensives. So we discussed about beta blockers and then angiotensin receptor blockers and then calcium channel blockers, as one of you rightly mentioned, amlodipine. Amlodipine is there, right? Or selenidipine. Amlodipine is not used nowadays because of, we have this common oral side effect or adverse effect, that is gingival hyperplasia. So clinidipine or selenidipine, 10 milligrams once daily. So in this process of observation, I have personally come across three major classes of antihypertensives. Three major classes. Of course, some of them use thiazides or diuretics. Some of them use different categories like alpha blockers are centrally acting. But if you start observing the medication which is being used right from your home, that's available in your home, it will be much more easier for you to remember the discussion which we are going through. So in this process, we discussed about beta blockers, ACE or angiotensin receptor blockers, calcium channel blockers, and of course, along with that, you might have seen elderly people taking aspirin, low dose aspirin, and also statins, just commonly statins, once during nighttime. That is lipid lowering drugs. So these are varied medications which are in fact used to manage hypertension, including aspirin and their statins. So we'll discuss all of this comprehensively now before the charging dries up. Okay. So consider these two as your homework. If you're familiar, that's good, extremely good. But if you're not, at least see to that you're just going into your home or searching the medication which is being used by your family members, including your parents, grandparents, etc. So this way you'll get familiarized with all the drugs, and you'll not have that fear or apprehension that these are foreign. Okay, you'll get familiarized with names. So consider these two tasks as your homework. And today we'll discuss the following questions as you can see in the thumbnail. So what are various drugs used to manage hypertension? The indications, contraindications, which are very, very important. We have some compelling indications and contraindications. Let's take, for example, beta blockers. They're not used in patients with pulmonary issues or asthma history, right? Something like that. And what about alpha blockers? Alpha blockers tend to cause fluid retention, so they're not used in case of patients with fluid or urinary incompetence. So there are certain compelling contraindications. What about ACE inhibitors or ACE blockers? In case of pregnancy, they are teratogenic, then they are contraindicated. So we'll discuss some of the indications and contraindications. We'll also briefly go through the dosages and side effects. Dosages are very easy to remember. See, if I say a beta blocker, metoprolol, I've seen my family members taking 50 milligrams once daily. What about losartan, candesartan, 50 milligrams once daily? What about calcium channel blockers? Amlodipine is 5 milligrams once or twice a day, or cilindipine 10 milligrams once a day. So it will be very much easy for you to remember if you know what uh, in reality is happening pertaining to the doses and medication. And which antihypertensive drug specifically causes cough, chronic cough? So one of the important adverse effects associated with one major class of antihypertensives, we'll discuss that now. And which antihypertensive drug class is the best? We have thiazides or diuretics. We have ACE inhibitors, ACE blockers, beta blockers, alpha and beta blockers, and then we have calcium channel blockers and centrally acting. So we have various major classes which are used for managing hypertension. So which of them is the best? So let's go through that as well. And finally, before we conclude our session, can lifestyle modifications towards positivity? So positive lifestyle modifications, can they lower blood pressure? So we'll conclude with that particular question, right? So I'm sure by the end of this session, you'll be able to answer all these questions. Literature fast information pertaining to the same in updates group. Basically go through while I'll be reviewing some key important points pertaining to the same. So as most of you might rightly mentioned, yeah, AC inhibitors, angiotensin converting enzyme inhibitors are associated with chronic cough. Cough can be seen immediately or few weeks or few months later. It's because of this inhibition of enzyme, angiotensin 1 accumulates, and it has a tendency to sensitize cough reflex. The exact mechanism is unclear, but angiotensin 1 is known to sensitize the cough reflex. So that's the reason why we have angiotensin blockers, which most of our family members do use, and which we might probably use. Hopefully not, but let's hope for the best. So angiotensin blockers are not associated with cough, so as you rightly mentioned. So we'll start with non-drug therapy. So we have pharmacological management, non-pharmacological management, as you guys are all aware. So first we'll deal with non-pharmacological, the preventive aspect. Appropriate lifestyle measures. So this is very simple to understand as well. See, positive lifestyle changes like regular exercise or physical activity, not something which is sedentary. Unfortunately, the gadgets and all which we are using, they promote sedentary lifestyle, but On the go, positive lifestyle is very much crucial. Managing obesity, limiting or stopping intake of alcohol, smoking, and good diet, which is very, very important. Good diet, such as consuming lots of fruits and vegetables, right, and whatnot. So we can incorporate like meditation, stress managing protocols, etc. So all of this can be incorporated in order to manage or even lower hypertension, as clearly stated here. These measures can be used to lower hypertension. What about antihypertensive drugs, thiazide and other diuretics? So you can see a daily dose of 2.5 milligrams of bendroflumethiazide or zero point 0.5 milligrams of cyclopentazide, which can be used, and also more potent loop diuretics such as furosemide 40 milligrams. So you can just make a note of these drugs along with their dosages. That's it. That's more than sufficient. Okay. And coming to beta blockers, so we have seen like metoprolol, atenolol, etc. So metoprolol 100 to 200 milligrams daily, atenolol 50 to 100 milligrams daily, bisoprolol 5 to 10 milligrams. These are cardio selective, beta 1 selective. Consider this very, very important, right? So beta 1 selective, cardio selective are preferred. And labetalol, carvedilol. Labetalol 200 milligrams to 2.4 grams daily. Carvedilol 6.25 and to 25 milligrams. So labetalol and carvedilol. So you're in a lab trying to carve your wax patterns. That's how we used to remember. So labetalol, carvedilol, these are both alpha as well as beta blockers, as you are aware with the classification. So even they can be used for managing hypertension. And most importantly, do underline this, labetalol can be used as infusion in malignant phase hypertension. And coming to ACE inhibitors. So ACE inhibitors, as you're all aware of, enalapril, ramipril, lisinopril, and also you can note down the doses or just underline the same. So 20 milligrams, 5 to 10 milligrams, 10 to 40 milligrams respectively daily. And these angiotensin converting enzyme inhibitors, ACE inhibitors, we have some special considerations, especially in renal patients. So as you can see, I've underlined the same. So these ACE inhibitors can reduce the filtration pressure of the glomeruli and precipitate renal failure. So we should exercise caution when using the drugs in the renal patients. And the side effects are, do underline them, as you can see, first dose hypotension, and along with that, cough, rash, hyperkalemia. So I want you to remember these three, at least first dose hypotension, hyperkalemia, and cough, chronic cough. Consider this very, very important. Okay. And then we have angiotensin receptor blockers, losartan, candesartan, etc. So losartan, a daily dose of 50 to 100 milligrams, valsartan, 40 to 160 milligrams. So these do not cause cough and are better tolerated. Okay. And then coming to calcium antagonists. So we have amlodipine, cilnidipine, dipins, etc. So amlodipine 5 to 10 milligrams, nifedipine 30 to 90 milligrams daily. So remember, amlodipine is associated with one of the oral manifestations, has an adverse effect, that is gingival hyperplasia, as you guys are all aware of. And also you can underline another important point here, the rate limiting calcium antagonists, especially diltiazem, verapamil, can be used when hypertension coexists with angina, even beta blockers. So they can be indicated, and in fact, they're indicated in cases of hypertension. Managing hypertension, also angina. And then we have other drugs like alpha blockers, centrally acting drugs. So we can see alpha blockers like prazosin, endoramin, doxazosin with the dosages, which can be used for managing hypertension. And do underline this, minoxidil. It's not usually advised for females as it has a tendency to increase facial hair. So do underline that point. And centrally acting drugs like methyl-dopa and clonidine. So you can see the doses can also be used as effective antihypertensive. So these are various drugs, various major classes of drugs along with their doses, which you can make a note of. And finally, before we conclude, you can see various classes. In fact, yeah, I think I posted this image as well. You can see various classes of drugs, their indications and contraindications. So you can see alpha blockers, they are indicated chiefly in benign prostate hypertrophy, whereas contraindicated in case of urinary incontinence because they tend to cause urinary retention, fluid retention, right? And AC inhibitors, they are indicated in case of heart failure, type 1 diabetic nephropathy, etc. And they're contraindicated in case of renovascular disease, pregnancy. So pregnancy, it's teratogenic. Renovascular disease, we have just gone through the mechanism because they are known to reduce the filtration pressure and precipitate renal failure. So do make a note of that point and consider that very, very important. Angiotensin 2 receptor blockers, they're better compared to ACE inhibitors. Like they don't cause these side effects like cough, hyperkalemia, etc. First dose hypotension. However, they're contraindicated in case of pregnancy. So beta blockers in case of myocardial infarction, angina, heart failure, and contraindications include asthma, pulmonary issues, heart block, etc. Calcium channel blockers in case of elderly, in case of those with angina, and calcium channel blockers rate limiting or contraindicated in case of heart block or heart failure. And finally, diuretics or thiazides, they are indicated in elderly patients, compelling contraindications, gout. So do make a note of these points and especially focus on the indications and contraindications. Side effects and all we already discussed pertaining to the same. And you can see adjuvant drug therapy includes aspirin and statins, which you're all familiar with. So we go with low dose aspirin, which acts as an antiplatelet agent. Okay. And also we have various drug combinations, but we'll conclude this here, given the constraints we have, and we'll review the questions which I posted once again in the form of a thumbnail, and then we'll say goodbye. Okay. So if I ask you, before we start with the first question, let me ask you this. So which antihypertensive drug class do you think is the best? So I've gone through so many things. We have seen so many side effects, contraindications, indications. If you closely observe, each class of antihypertensive drug has its own set of indications, has its own set of indications, has its own set of contraindications, has its own set of side effects. So which antihypertensive class do you think is the best? Srishti, is MDSOP worth it? We'll discuss that at the end of the session, or you can get back through mail. Beta blockers, thiazides, ACE inhibitors, angiotensin blockers, alpha blockers, alpha plus beta blockers, aspirin, statins. Which one do you think is the best? Exactly. Exactly. It's not that one class is superior to that of the other. At the end of the day, it's all about cost, convenience, the complaints of the patient, the response of the patient, the adaptability of the patient to that particular drug. And the objective is to have minimal side effects, isn't it? So any class of drug can be used provided the patient is benefited. It is patient centric, not drug centric. So each, as we discussed, each drug class has its own indications and contraindications. Ultimately, it depends on how the patient is complying with that particular medication, and if he or she is exhibiting fewer side effects. We cannot avoid side effects, but with fewer side effects and risk versus benefit analysis, we go accordingly. So you usually see in most of the cases, as you mentioned, beta blockers are indicated. In elderly patients, thiazides are indicated. Even calcium blockers are indicated. AC, angiotensin receptor blockers are indicated, or even combination of drugs. So this combination has synergistic activity. At the same time, the side effects can be lower. So combination of drugs can also be used, and I've seen personally my family members using a combination of beta blockers and calcium channel blockers, angiotensin receptor blockers, etc. It's a combination can also be used. So there is no single best class, and it depends, as Jaydev rightly mentioned. Okay, we can't say all or none. It's obviously all. Okay, yeah. Now let's review the questions once again, try answering them, and then we'll conclude the session. So, what are various drugs used to manage hypertension? You can just name the drug classes. I'm sure you'll memorize all the drug names and the dosages. So, what are various drugs which can be used to manage hypertension? So, beta blockers can be used, thiazides, AC inhibitors, AC receptors, angiotensin receptor blockers, calcium channel blockers, alpha blockers. Good. What about platelets and statins? Adjuvant therapy, even they can be considered in the management aspect. Yeah, good. Aspirin as well as statins. Okay, good. And indications and contraindications, we have clearly mentioned compelling indications and contraindications in the form of a table. Do review it once and consider this very, very important. Okay, all the indications, specific indications and specific contraindications, right? I've already posted the table in updates group. So consider this as a homework. Do make a note and then you can get back. Wonderful. So dosages and side effects. Dosages, you can follow Tripartite or any pharmacological textbook, or you can rely on the information given over here. So side effects are very important, right? So cough is one something which I picked up because it was asked at random in several previous entrances as well, right? So you can go through various other side effects, right? And also there is a medication which causes constipation. I think it is a diuretic. I don't exactly remember. I'll get back to you now. So you can see there is one drug which specifically causes constipation. Yeah, a calcium channel blocker, verapamil. You can do underline that point as well. I didn't mention that previously, but I've underlined it. The main side effect of verapamil is constipation. Okay, yeah, good, verapamil. And then which antihypertensive drug causes cough? Yeah, angiotensin converting enzyme inhibitors, right? There is a proposed mechanism that it could sensitize cough reflex, even though the exact mechanism is unclear. So this can be overcome by prescribing ACE blocker, I mean angiotensin receptor blockers in case of patients. In fact, that's one of the indications if you observe the table. So those who are sensitive to angiotensin converting enzyme inhibitors, right? You can prescribe angiotensin receptor blockers. Good. And finally, can positive lifestyle changes lower blood pressure? Yes or no? No explanation. Can positive lifestyle modifications lower blood pressure? Yes or no? Of course, yes. So, positive lifestyle changes include diet, exercise, stress lowering factors. Even though stress has been mentioned to be having a very limited role or very little evidence in the etiopathogenesis of hypertension, but still, positive lifestyle changes like regular exercise, consuming more fruits and vegetables, managing obesity, and then limiting or avoiding intake of alcohol, smoking, etc. And saturated foods. A specific mention has been made out about saturated foods. So saturated foods, the issue is we love saturated food. We love saturated fat. Anything which dips in oil is our favorite, right? So that is something which we need to modify. Okay. So the power is still not. I don't think we still have power. So I think we can consider this as a success. We managed to complete the session. And you have any questions whatsoever, you can always get back through mail 24/7, right? Also go through the literature which is posted in updates group. I'll be giving you additional information in the form of files or in the form of images in our e-classes. And pertaining to previous live sessions, I posted all additional information, including the images, yesterday's sessions images in our e-classes. You can check them out. And today night, I'm going to have a study club discussion at 9 p.m. Indian Standard Time as usual. So Anku and Tenku will be back. Okay? Exactly. People are not serious. That's true. Agreed. Okay, appeared the same in 2017. Right. Okay. Okay, guys. So that's it. So do consider the two practical homework which I've given you. Check out your toothpaste, the composition, and also to check out the medication, antihypertensive medication, which your family members are using, and get familiarized with the same. You'll have much more confidence when you're dealing with the names of the drugs. Okay, it's very simple topic. Of course, it's memory based, and you can master the same by making a note of it, using sticky notes, underlying important points, and then spend the next 2 to 3 days, morning 10 to 15 minutes to memorize all these things. You'll grow confident, and you'll definitely remember at least till the date of exam. Okay. Yeah, Toffee is elsewhere. So that's the reason why Toffee is not able to join. Toffee is around 350 to 400 kilometers away from my location. So Toffee will be back soon once the lockdown is lifted. Yeah, regarding AIMS exam, I'm not sure of the dates, guys. So we need to keep a tab on aimsexams.org website. It's postponed, as we all know. We have to wait and watch. Because don't use car, use cycles. Because if I don't use a car, I can't get a power. I have a power supply. I'm using the power supply of my car, and also I'm using some air conditioning so that I don't sweat excessively, because it's very hot. It's 12 o'clock and we don't have power. So that's the reason why I'm using a car. Which car, sir? Which car? It's a good car. It's definitely a good car. Okay, guys. I'll see you again tomorrow at 11 a.m. Indian Standard Time. Hopefully, we can continue our regular sessions. And tomorrow we'll have MCQs discussion, exclusively MCQs discussion pertaining to hypertension. We'll deal with a different range of multiple choice questions, covering all the topics from hypertension part 1, part 2, as well as part 3. Okay, I'll see you again tomorrow. So have a great day ahead. And before I conclude, if you have the willingness to do, no matter what the external challenges are, you'll get it done somehow. So all we need is that willingness to do. That's it. So as they say, where there is a will, there is a way. It's indeed true. So wish you all the best. Love you all. Take care. Bye.